So we know that most disease processes start with the development of inflammation in varying degrees. And one of the major contributing factors of inflammation is insulin. So let me explain to you the difference between glucose and insulin. Glucose is what your body produces whenever you eat something that has carbohydrates. So you eat carbohydrates, your body's natural process is to make glucose out of that, and that is what our body uses as its fuel. That's what every cell uses as its fuel. Insulin is kind of the opposite. It works in the opposite way of glucose. Whenever your glucose levels start to rise, insulin is produced by your pancreas to help lower that glucose level. And it does that by essentially like shuttling glucose from your bloodstream into your muscles and into your cells. So it helps to lower your glucose level. What we know is that elevated insulin levels are a major factor of inflammation. So your glucose level can be normal when it gets tested, but it's very uncommon for people to get their fasting insulin level tested. So we know that your insulin levels can be high even though your glucose numbers are normal, but they never get tested, so we don't know what level of inflammation you're having. The other thing that's important to know about insulin is that higher insulin levels tend to contribute to more fat storage. So insulin is a fat storage hormone. So if your body is producing a lot of insulin to keep your blood sugar normal, and we're only testing blood sugar, we don't know how much insulin is being tested or how much insulin is being produced. It's a very simple blood test that any doctor really can test. So if you have any question about blood sugar handling, any potential family history of diabetes or pre-diabetes, it's really smart whenever you get your labs done, at least once a year, to have your fasting insulin tested along with your glucose. So, hope that helps.